Let us talk about the deltoid region or scapular region, otherwise called shoulder region. We are talking about the shoulder today. Your rounded contour of your shoulder is due to a beautiful muscle underneath it called as a deltoid. Okay, let's see which are the muscle underneath it, what they do, and some intermuscular spaces underneath it. Yeah. So we have removed the skin, superficial fascia and deep fascia to expose the muscles on the posterior aspect of the trunk, back of the trunk, as well as the shoulder region. Okay. So there will be another video regarding the posterior aspect of the trunk or back. Let's talk about the scapular region or other device called the shoulder region today. So the skin over this area is histologically thin skin with hair, sebaceous transfer glands. The skin is comparatively thicker on the posterior aspect of the trunk because we sleep on the back usually. Okay, same way the superficial fascia is also will be thicker. On the back of the neck you can see the adipose tissue will be of brown type. Adipose tissue is brown type adipose tissue, you can see and the deep fascia is very thick. Deeper to that we have the muscle layer. What you are seeing is this is the scapula. Okay, and this muscle which is trapezoid in shape, which is making a triangle on one side, when the muscles of both sides together forms a trapezoid shape called that. So this muscle is called as trapezius. In the same plane you can see another muscle here on which you got the injection. This is the deltoid. We are going to talk about the deltoid today. Okay. Yeah, what is the peculiarity of the skin over here? The skin is supplied by the lateral supraclavicular nerve. Pain, touch, temperature from the skin from the upper part of the deltoid is carried by the lateral supraclavicular nerves. Below by the lower upper lateral cutaneous nerve of the arm. Upper lateral cutaneous nerve of the arm, which is nothing but the continuation of the axillary nerve. We will talk about the axillary nerve in greater detail in coming slides. Okay. So let's talk about this area now. So the term deltoid is derived from the term delta. This is an inverted delta, isn't it? Looking like an inverted delta, hence the name deltoid. This is a powerful abductor of your arm up to 90 degrees. So let's see from where it comes from, where it goes. This is the clavicle. This is the lateral end of the clavicle, which articulating with the corresponding facet on the medial end of the acromion, forming the acromio the clavicular joint. This is the acromioclavicular joint, which is a simple synovial joint. Just small sliding movement is possible over here. Acromioclavicular joint. Okay, this is the acromion process, and this is the acromion process and the crest of the spine. Okay, so our deltoid takes origin in a V-shaped manner from all this area. How? From the anterior border of the lateral 1/3 of the clavicle, the lateral border of the acromion process, lower lip for the crest of the spine. So this is the origin of the deltoid. Okay, let's see once again. So here, this is the acromion process and this is the clavicle. So some fibers are coming from the anterior fibers are coming from the clavicle. Posterior fibers are coming from the lower lip or the crest of the spine of the scapula, and this area, the acromion process, give origin to the multipinnate fibers of the deltoid. Here on the lateral border of the acromion, there are 4 small minute tubercles which give attachment to 4 fibrous septae You can see 1, 2, 1, 2, 3, 4. Okay, which descend downwards, which get interdigitated with the similar fibers, mirror septa coming from the upper part of the posterolateral surface of the humerus. So there we have a V-shaped area called as the deltoid tuberosity. From the deltoid tuberosity, there arises similar fibrous septae. These septae interdigitate with each other with the one which is coming from the acromial process. So in between this area, there are number of fibers are arranged. So what will be the consequence? In a limited area, we can accommodate maximum number of fibers. Okay, so the number of fibers are directly in proportional to the power of contraction. Okay, so this area is the one which abduct your arm up to 90 degree. The initiation of the abduction is done by the supraspinatus muscle about to 0 to 18 degree. Thereafter, from 18 to 90 degree, 90 is done by the acromial fibers of the deltoid, which is multi-pinnate fibers. Okay, whereas you can see the clavicular fibers as well as the fibers coming from the crest of the spine is strap muscle, whereas the acromial fibers are the multi-pinnate fibers which have maximum number of fibers accommodated. Done? And these fibers converge downwards into the anterolateral surface of the humerus, where we have a V-shaped muscular impression, a V-shaped area called as the deltoid tuberosity. That is the insertion of the deltoid. So this is the anterior fibers coming from the anterior border of the lateral 1/3 of the clavicle. These are the acromial fibers which is coming from the lateral border of the acromial process, and this is the posterior fibers coming from the lower lip of the crest of the spine, and they all converge towards to the humerus onto the deltoid tuberosity. Done? So let's see what this muscle do for you. Clavicular head. Clavicular head is the flexion, adduction and medial rotation. Posterior fibers, again they are the flexion, adduction and the medial rotation. For extension, adduction and medial rotation. Whereas the middle fibers are the powerful abductors. Anterior fiber, flexion, adduction and medial rotation. Posterior fibers, extension, adduction and lateral rotation. Whereas the middle fibers are abductors. Done. The entire muscle is supplied by the nerve, axillary nerve. So let's see what are the things underneath the deltoid now. So what you're seeing as an outline in this X-ray is the deltoid, is of the shadow is of the deltoid. And let's see what all things are underneath it. You can see this is the lateral end of the clavicle. This is the acromial process. This is the coracoid process. This is the glenoid cavity. This is the head of the humerus. Okay. Clavicle, acromial process, coracoid process, and this is the glenoid cavity, head of the humerus. So let's see what are the muscles and the bones underneath the deltoid now. So the deltoid covers the anterior, posterior and the lateral aspect of the upper end of the humerus. So everything coming from this, all the structures located in the upper end of the humerus in this area will be under the cover of the deltoid. Okay, so naturally the shoulder joint and the acromioclavicular ligament as well as the coracoacromial ligaments will be under the deltoid. Clear? So here comes, this is coracoid process, this is the acromial process. So this is called as the coracoacromial ligament. This is the coracoacromial ligament. So coracoid process, acromial process, coracoacromial ligament makes the coracoacromial arch, which act as a secondary joint for the shoulder joint, secondary capsule for the shoulder joint, because it prevents the upward dislocation of the head of the humerus upward. See, there's a disparity in the size of the head of the humerus and the glenoid cavity. Glenoid cavity is too small and shallow for the head of the humerus. So it's a very weak joint. At the same time, it enjoys maximum flexibility, maximum amount of freedom. The freedom comes at the cost of the stability. So there is a chance for the upward dislocation because of the disproportionate size difference between the head of the humerus and the glenoid cavity. So there's a chance to move upward. This will be prevented by this ligament and these two bony structures. So it is called as the secondary socket for the shoulder joint. Which one? Coracoacromial arch. Done. Then the shoulder joint is completely, except inferiorly, it is there on the anterior, posterior, lateral aspect, is completely covered by the deltoid. So what all thing will be under the deltoid in each bony portion? Upper end of the humerus we have the lesser tubercle, greater tubercle, intertubercular sulcus, and all the muscle attached over here. On the lesser tubercle tuberosity you have the insertion of the subscapularis. On the greater tubercle we have three muscles above downwards: supraspinatus, infraspinatus, and teres minor. Here comes. This is supraspinatus to the upper impression, infraspinatus on the middle impression, and the teres minor onto the lower impression on the greater tubercle. Okay, and this is the subscapularis coming from the subscapular fossa of the scapula and inserting into the lesser tubercle, which is directed anteriorly. Now the gap between this lesser and the greater tubercle or tuberosity is the intertubercular sulcus, or otherwise called as a bicipital groove. So in this bicipital groove you have studied three muscles are attached. On the lateral lip, pectoralis major insertion; on the medial lip, insertion of the teres major; and on the floor we have the insertion of the latissimus dorsi. Done? So these muscles, the inserting portion, the terminal portion of these muscles is completely under the cover of the deltoid. And what about the coracoid process? It gets insertion of one muscle and the origin of two muscles. The insertion of the pectoralis minor and insertion origin of the coracobrachialis and the short head of biceps. Okay, so the supraglenoid tubercle on the upper part of the glenoid cavity of the scapula give origin to long head of the biceps. So that passes through the bicipital groove. It passes over the head of laterally over the head of the humerus within the capsule of the shoulder joint. So the origin of the long head of the biceps is intracapsular in nature. It comes out of the capsule and lie in the intertubercular sulcus, long head of the biceps, which join with the short head of the biceps, which arising from the acromion process to form the belly of the biceps. So what I meant to tell is that upper part of the biceps is also under the cover of the deltoid. Clear? So, as we told, pectoralis minor. Here will be the attachment of pectoralis minor, coracobrachialis, short head of the biceps, long head of the biceps, subscapularis, on the lesser tubercle, supraspinatus, infraspinatus, teres minor. On the greater tubercle, pectoralis major, dorsimus dorsi, teres major. On the wall, the floor, as well as the medial and lateral lip of the bicipital groove, long head of the biceps in the intertubercular sulcus. All these are under the deltoid. So we need to reflect the deltoid to expose or uncover all these structures. Done? So here, what are the vessels and nerve under the deltoid? You have seen this nerve, axillary nerve. The axillary nerve you have seen while doing the dissection of the axilla. You have seen this nerve on the posterior aspect, or when you lifted the third part of the axillary artery, you have seen two things. One is radial nerve, other structure was the axillary nerve. Both of them were lying over these beds formed by the subscapularis, teres major and latissimus dorsi. Done? So, these two nerves, radial nerve and axillary nerve, were sandwiched between the third part of the axillary artery and between the subscapularis, teres major and the latissimus dorsi muscle. So, from the axilla, it escaped through a intermuscular space called quadrangular space to wind around the surgical neck of the humerus, and on its way it supplies the axillary, the nerve supplies the deltoid muscle and also teres minor. So remember, the axillary nerve supply two muscles. They are the deltoid and the teres minor. We'll come to that again, then just telling you incidentally. Okay, and it also supply a small area of the skin over the deltoid. So the structure undercover, the nerves and vessels are the axillary nerve and the anterior and posterior circumflex humeral artery. Do you remember who are they? They are the branches of the third part of the axillary artery. The posterior circumflex humeral artery along with the axillary nerve passes through the quadrangular space, winds around the surgical neck of the humerus, where it meets with the anterior circumflex humeral artery, which pass underneath the coracobrachialis and reaches the surgical nerve, where it meets the posterior circumflex humeral artery. Done? So let's see what are structure under the deltoid coming to the bursa. What do you mean by bursa? Bursa are small closed synovial sacs. Synovial membrane make a small closed pillow-like structure. What is the function of it? It prevents the friction. It prevents the friction between the adjacent structure. So maybe it will be between the tendon and a bone, or it can be between skin and the bony structure, as you have in the elbow, the point of elbow. You have on the posterior, what you are feeling is the posterior surface of the olecranon process. Okay, there's a bursa over there. So you can the function of the bursa is to reduce the friction between the adjacent structure. Here you can see this coracoacromial arch. This is the coracoid process, this is the acromion process, and connecting them there is a ligament called as the coracoacromial ligament. Okay, below the coracoacromial ligament is the area through which the supraspinatus from the supraspinous fossa pass laterally to get inserted into the greater tubercle. The way you are seeing, this is supraspinatus tendon, reaches the upper impression on the greater tubercle the upper impression on the greater tubercle. Okay, so there's a chance that this tendon, supraspinatus tendon, gets rubbed against the coracoacromial ligament. In order to minimize this friction, we have a bursa here, a synovial pillow, you can call it as the synovial yellow. You can find this during dissection as a small creamy colored structure. It will be compressed. So the bursa underneath the coracoacromial ligament is called as subacromial bursa. This is the biggest bursa in our body, subacromial bursa. Okay, so the function of this bursa is to prevent the rubbing of the supraspinatus muscle against the coracoacromial ligament. That also run under the deltoid. Okay, so this is the coracoacromial ligament. The entire structure is called as the coracoacromial arch. So let's see, once you reflect the deltoid, how you are going to reflect the deltoid. You cut the deltoid along the origin. You start cutting from the, reflecting from the lower lip or the crest or the spine. Then you cut along the, reflect along the lateral border of the acromion process as far as possible, and then you just reflect it downwards. As you do it, you feel some resistance because from the under surface you can see the axillary nerve enter the muscle. So you need to carefully detach that from the under surface of the deltoid and reflect the deltoid downwards. Then this will be the view you will be getting. Okay, you have to reflect a part of the trapezius muscle to expose the supraspinatus. Then you can see the muscles here. This is the infraspinator, the medial 2/3 of the infraspinous fossa. You can see here this area, this infraspinatus, and along the lateral border of the scapula on the dorsal aspect we have two muscles here. Teres minor above, upper 2/3 by the teres minor, lower 1/3 give origin to another muscle called as the teres major. And even you can see the latissimus dorsi moving towards the insertion. Subscapularis you will be seeing, if you just turn the body in a supine position, you can see the subscapularis insertion. So these are the muscles, the supraspinatus, infraspinatus. This is the teres minor, what I am touching, the upper one. This is the teres minor. The lower portion, this is the teres major. This complete chunk is the triceps. This is the long head of the triceps. This is the lateral head of the triceps. You need to cut and reflect the lateral head to expose the medial head. So supraspinatus taking origin from the supraspinous fossa, medial 2/3 of supraspinous fossa, and the muscle is inserting into the upper impression on the greater tubercle. Okay. The nerve is suprascapular nerve. Who is the suprascapular nerve? You have seen the Erb's point. The upper trunk of the brachial plexus is called as the Erb's point. There we have seen 6 nerves are meeting, C5, C6, and there are 2 divisions. And from this upper trunk, 2 nerves are arising. One is the suprascapular nerve, another one is the nerve to subclavius. So this nerve muscle is a branch coming from the upper trunk to suprascapular nerve. Suprascapular nerve supply both supraspinatus as well as the infraspinatus. Supraspinatus is the one which initiating the abduction. So from the 0 degree, from the side of the body, the arm is abducted up to 90 degree. So the supraspinatus is the one which initiating the abduction. From side of the body, it initiates the abduction up to 18 degree. from the 18 to 90 degree is done by the middle fibers or acromion fibers of the deltoid muscle. From 90 to 180 degree, that is called overhead abduction. Overhead abduction is a combined action of the upper and lower fibers of the serratus anterior and the upper and lower fibers of the trapezius and the serratus anterior, done by the upper and lower fibers of the trapezius muscle and the serratus anterior forces the overhead abduction. Done? Yeah, we talked about the coracoacromial arch already. This is the coracoacromial arch formed by the coracoid process, acromial process. Here is the ligament called as the coracoacromial ligament. Underneath passes the supraspine. What I am touching right now is the supraspinatus tendon. So a bursa is interposing between the coracoacromial ligament and the tendon of the supraspinatus. That bursa is called as the subacromial bursa. Infraspinatus muscle. It's a comparatively larger muscle which taking origin from the medial two-thirds of the infraspinous fossa, passes upwards and laterally and inserted into the middle impression on the greater tubercle of the humerus, upper end of the humerus. Okay, and it is supplied by the suprascapular nerve. Both supraspinatus and infraspinatus are supplied by the suprascapular nerve. Okay, infraspinatus and the teres minor muscles are lateral rotators. Okay, infraspinatus, this green thing, and the muscle parallel to it. This is the teres minor. Both are lateral rotators. So this is the teres minor, which taking origin from the upper two-thirds of the lateral border of the scapula on its dorsal aspect. Pass upwards and laterally parallel to the infraspinatus and get inserted into the lower impression on the greater tubercle of the upper end of the humerus. So three muscles are inserting on the greater tubercle: supraspinatus, infraspinatus and teres minor. Okay, action is lateral rotation. The nerve supply by axillary nerve. I already told you that the axillary nerve supply two muscles, deltoid and the teres minor. Okay. Teres major is comparatively bulkier muscle which taking origin from the lower one-third of the lateral surface of the scapula on its dorsal surface. Pass upwards and laterally to get inserted into the medial lip of the bicipital groove of the humerus. This is supplied by the lower and upper subscapular nerves. Upper and lower subscapular nerves are branches of posterior cord of the brachial plexus. Okay. It's an adductor and medial rotator. Even the pectoralis major is also an adductor and medial rotator. Latissimus dorsi is also adductor and medial rotator. Teres major is also adductor and medial rotator. So you can understand the muscles on the lateral lip and the floor and the medial lip of the bicipital groove are adductors and medial rotators. The lady and the two majors are adductors and medial rotators. Who is the lady and majors? Lateral lady is the latissimus dorsi, majors are the pectoralis major and the teres major. Subscapularis fills up the subscapular fossa, medial two-thirds of the subscapular fossa, that is nothing but the ventral surface of the scapula. Run in front of the shoulder joint capsule and inserting into the lesser tubercle. The one and only muscle attachment on the lesser tubercle is of subscapularis. Okay, subscapularis supplied by the upper and lower subscapular nerves. They are also adductor and the medial rotator. What is this rotator cuff or musculotendinous cuff, otherwise called musculotendinous cuff? The four muscles which are inserting onto the lesser and the greater tubercles, as they go toward the insertion, the tendons get flattened up and they join with each other to fuse with each other and partially fuses with the joint capsule of the shoulder joint. This is called as rotator cuff. Is that clear? Toward the insertion, all the four muscles which are inserting into the lesser and the greater tubercles are fusing with each other and also partially fuses with the shoulder joint capsule. This is called as the rotator cuff. The function of the rotator cuff we will be dealing while doing the shoulder joint. So once you reflect the deltoid, there we can make out some intermuscular spaces. One quadrangular space and two triangular spaces. Let's see what are they now. Let me move here. This is the teres minor, which is going upward. Okay, then you can see which is running downwards. This is the long head of the triceps. You can see long head of the triceps is lying over another muscle which is going laterally. This muscle is the teres major. So this is teres minor. This is long head of the triceps. This is the teres major. Now this is the surgical neck of the humerus. Now you can make out one quadrangular space here. Okay, which is bounded above by the teres minor, below by the teres major, medially by the long head of the triceps, and laterally by the surgical neck of the humerus. This is the quadrangular space. If you approach from anterior, subscapularis and the lower part of the shoulder joint capsule, then teres minor will be coming. If you are approaching from the posterior aspect directly, you can see the teres minor above, teres major below. Medially, the lateral border of the long head of the triceps, laterally surgical nerve. The two things which escape through the quadrangular space from the axilla are the axillary nerve and the posterior circumflex humeral artery, which is the way to the surgical neck of the humerus. Quadrangular space is done. Now let's go for the triangular spaces here. So here the gap between the teres minor, this is the teres minor, this is the teres major below it, this is the long head of the triceps. So this space is the upper triangular space. Above, or otherwise you can call it medially. Either you can call it above or you can call it medially. Above teres minor, below teres major, laterally long head of the triceps. This space is called as upper triangular space. The one and only occupant over this area is the circumflex scapular artery. Circumflex scapular artery. Who is this circumflex scapular artery? It's a branch of subscapular artery. Subscapular artery is the branch of third part of the axillary artery. So on its way towards the lower end of the subscapularis, the subscapular artery gives off a big branch which is bigger than the subscapular itself. It winds around the origin of the teres minor, enters into the infraspinous fossa and gives off branches in the infraspinous fossa, few branches in the supraspinous fossa, few branches in the subscapular fossa, to take part in the anastomosis around the scapula. We'll talk about the anastomosis around the scapula later. So just remember, the one and only content within the upper triangular space is the circumflex scapular artery. Now talk about the lower triangle. The lower triangle, you can see what is this muscle, you tell me? Teres major. Medially by the long head or the triceps. Laterally by the shaft or the humerus. So this upside down triangle is the lower triangle. Two things pass through it. They are the radial nerve and the profunda brachii artery. Radial nerve and the profunda brachii artery. Profunda brachii artery is the biggest branch of the brachial artery. So this is the way you can make the quadrangular and triangular spaces with your fingers. Teres minor, teres major, long head of the triceps, shaft of the humerus. Let us talk about the axillary nerve a bit more detail. So here this is the posterior cord of the brachial plexus, okay, and you can see the posterior cord of the brachial plexus after giving off the few branches, 3 branches, it continues as the radial nerve. Before that, a small terminal branch, the smaller terminal branch of the posterior cord is called as the axillary nerve. So this axillary nerve and the radial nerve lie posterior to the third part of the axillary artery in the axilla. It coming from the root value is from the C5 and C6. So this is the way it lies in front of the scapularis muscle, but deeper to the third part of the axillary artery. So from the axilla is slit downwards to enter into the quadrangular space. While in the quadrangular space, the nerve, the axillary nerve, divides into an anterior and posterior divisions. The anterior division goes along with the posterior circumflex humeral artery around the surgical neck of the humerus. On its way, it supplies the anterior part of the deltoid muscle. Okay, and then it's also supply the skin over the anterior part of the deltoid. Clear? So the posterior division supply the teres minor muscle. This is the anterior division. This is the posterior division. Posterior division supply the teres minor muscle. The branch towards the teres minor bears a small pseudoganglion. What do you mean by pseudoganglion? It is a collection of the neuroglial cells. It's not a collection of neuronal cell body. The nervous tissue contains neurons as well as the supporting cells called as neuroglia. If it is collection of neuronal cell body, outside the CNS is called as the ganglion. Okay, but here is not a collection of neuronal cell body, but it's a collection of the neuroglial cells. Hence, it is called as pseudoganglion, false ganglion. It gives off the branch to the teres minor and it supplies the posterior part of the deltoid. After that, it continues as the upper lateral cutaneous nerve of the arm. Posterior division continues as the upper lateral cutaneous nerve of the arm, which supplies the upper part of the skin over the upper part of the deltoid. Then ask me who is the lower lateral cutaneous nerve of the arm. Lower lateral cutaneous nerve of the arm is a branch of radial nerve. We'll come with that later. So it gives, the anterior branch gives a articular branch for the shoulder joint, then it supplies the anterior part of the deltoid and enters into the skin. Similarly, the posterior branch supplies the teres minor with a pseudoganglion on it. Then it enters into the posterior part of the deltoid, supply that area, become cutaneous to supply the skin over the lower part of the, upper part of the skin over the upper part of the deltoid. skin over the lower part. Axillary nerve lesion. Sometimes the injury happens to the axillary nerve due to the fracture of the upper end of the humerus in the surgical neck area. So naturally that is going to injure the axillary nerve. When the axillary nerve is injured, it's going to paralyze the deltoid muscle and teres minor. When the deltoid is paralyzed, that's going to make the flattened shoulder. The rounded shape of the shoulder is lost. The shoulder becomes flattened. And also the patient won't be able to abduct the arm up to 90 degrees. Another cause for the injury for the axillary nerve is the downward dislocation. Here you can see here, this is the glenoid cavity, this is the head of the humerus. You can see the head of the humerus is slipped downwards and occupy an area below the glenoid partially. So this is called a downward dislocation. The shoulder joint is least supported from below, so the chance to dislocate downwards is more. So it causes the flattening of the shape, flattening of the shoulder. So here you can see the normal rounded shape of the shoulder is shown, but this here you can see is flattened up. And there is a small area of loss of sensation on the skin over the lower part of the deltoid, because of the loss of the sensation due to the involvement of the upper lateral cutaneous nerve of the arm, which is a continuation of the axillary nerve. Upper part of the deltoid, the skin over the upper part of the deltoid is supplied by the supraclavicular nerve, whereas the lower skin over the lower part of the deltoid is supplied by the upper lateral cutaneous nerve of the arm, which is the continuation of the axillary nerve. Okay, that's all about the structure under the deltoid. Please give me feedback in the comments and see the dissection of the deltoid region. Thank you. We have partially exposed the deltoid. What we are seeing is the strap fibers coming from the lower lip of the crest of the spine of the scapula. This is the spine of the scapula. This is the lower lip of the crest of the spine of the scapula, which is strap muscle. As we come more laterally, here this is the acromion process. Here the fibers are multipinnate. As you go anteriorly, the fibers are coming from the anterior border of the lateral 1/3 of the clavicle. That also strap muscle. Now we are partially reflecting the deltoid to see the structure under the deltoid. Okay. So what you are exposed here is the teres minor. This is teres minor. Whenever you need it, zoom it up. This complete stuff is the infraspinatus. Complete muscle is the infraspinatus. This is teres minor. This is teres major. Okay, this complete stuff is teres major. This is the latissimus dorsi. This complete thing is the latissimus dorsi. Okay. Now this is the long head of the triceps. Long head of the triceps. Now let's see the quadrangular and triangular intermuscular space. Okay. Here above by the teres minor, the quadrangular space above bounded by teres minor, below by the teres major. Can you see this is the teres major? Same thing continues upward. This is the teres major from here to here. The shiny tendon. This is the teres major. Okay, medially long head of the triceps. So this these are the boundary above teres minor, below teres major, medially long head of the triceps, laterally surgical neck of the humerus. So what are the things coming out of the quadrangular space we'll see now. Okay, here you can see that this is the trunk of the axillary nerve. Axillary nerve verging the which winding around the surgical neck of the humerus. Okay, this is the trunk of the axillary nerve. You can see the muscle fiber, the deltoid is supplied by the branches coming from the axillary nerve. Okay, these are muscular branches coming from the artery. Which artery here? You can see one artery here. This is, can you go deeper? This is the posterior circumflex humeral artery, and this is the accompanying vein. This is the vein. The deeper one is the artery. This is the artery. What I am holding with the left hand is the artery. Posterior circumflex humeral artery. This is the posterior circumflex humeral vein, and this is the axillary nerve. Okay, that is the quadrangular space. Coming to the upper triangle, medially by the teres minor, below by the teres major, laterally by the long head of the triceps. So this is the space, upper triangle. The content is this one. This is the circumflex scapular artery. Circumflex scapular artery is the branch of subscapular artery, which is coming from the third part of the axillary artery. So it takes part in the anastomosis around the scapula. Done. Now coming to the lower triangle, you are seeing the distal part of the teres major here. This is the above by the teres major. Medially by the long head of the triceps, laterally by the shaft of the humerus covered by here. This is the lateral head of the triceps, laterally by the shaft of the humerus. Here you are seeing two things. This is the radial nerve in the spiral groove. Okay, radial nerve, and along with you can see one artery and one vein here. This is the profunda brachii artery, the biggest branch, the largest branch of the brachial artery, profunda brachii artery and profunda brachii vein, and the radial nerve. So these are the contents of the lower triangle. Above by the teres major, medially by the long head of the triceps, laterally by the shaft of the humerus, and the contents are the radial nerve and the profunda brachii vessels. Both are, this is the artery and this is the vein. Okay, this is the nerve. This is the artery. What I am holding with the left hand is the radial nerve. What I am holding with the right hand, this one is the profunda brachii artery. Profunda brachii vein. Done? Everyone saw?